emerging, re-emerging, and occupational disease, genetic pathogen as agent of bioterrorism, anthrax. WHO or FAO or OIE Joint Consultation on Emerging Zoonotic Disease EJD Geneva 2004. An emerging zoonosis is a zoonosis that is newly recognized or newly evolved or that has occurred previously but show an increase in incidence or expansion in geographical host or vector range. Re-emerging zoonoses REZ is used to refer to well-known diseases which are managed or controlled to a level that poses no imminent danger to the animal and human, but has since reserved its course to show an increasing trend in respect of its incidence. Tuberculosis HIV after 1970 have been momentous in the history of veterinary medicine as an array of new infectious agents or diseases depicting animal-human connection were reported and researched across the globe. Carnosaur forest disease virus, rotavirus, Ebola and hantavirus, oryzas, E. coli, bird flu, nymph virus, severe acute respiratory syndrome virus. A report on the status of zoonosis in Southeast Asia (SEA) was presented by WHO during its regional meeting on zoonotic disease held in Jakarta. The role of global warming and climate change is affecting the biodiversity and distribution of animal and microflora with a bearing on emergence of zoonosis was discussed. Avian influenza strain H5N1, nymph virus, rabies, JE, and leptospirosis were discussed. Common emerging diseases in South Asia: rabies, Japanese encephalitis, avian influenza, leptospirosis, salmonellosis, SARS, nymph virus, plague, and anthrax. Bioterrorism. What is bioterrorism? Bioterrorism involves the national, international, deliberated, or unlawful release of virus, bacteria, or their product, example toxin, to cause morbidity and mortality in human, animal, or plant. Bioterrorism is an attractive weapon because biological agents are relatively easy and inexpensive to obtain, can be easily disseminated, and can cause widespread fear and panic beyond the acute physical damage. In 1998, courses defined bioterrorism is the threat of use of biological agent by individual or group motivated by political, religious, ecological, social, or for other ideological object to inculcate fear or cause illness or death in order to achieve their objectives. CDC classified bioterrorism agent into three major categories ABC based on following criteria: ability of the agent to be easily disseminated, capability to be transmitted from person to person, potential to cause significant morbidity and mortality, capacity to cause public panic and social disruption. Category A: Anthrax, botulism, dengue, Ebola, hantavirus, Legia, Marburg, plague, Teneria. Category B: Brucella, calcivirus, chikungunya, cholera, E. coli, hepatitis A, resin, toxin, salmonella, typhus fever, yellow fever, Zika. Category C: antimicrobial resistance, Hendra, influenza, MERS, nymph, prion, rabies, SARS, tick-borne tuberculosis. Mode of administration of biological agent. Mode of administration of biological agent. Dispersal system for inhalation exposure, mail or package, commercial available spray device, fire extinguisher, conditioning system, smoke generator, street air freshener, contamination of food or water supply, individual consumption item, food chain contamination, injection contaminated needles, projectile or contaminated sharpener, direct contact by infected person or animal, military munitions, anthrax, will shorter disease, hide porter disease, malady, charbon, malignant pustule, malignant carbuncle, Mildebrand, splenic fever, malignant edema. Greek word anthracis, which means cold. It was the first human disease to be attributed to a specific pathogen, increased international trade in animal and animal product, epitomize a greater risk of dissemination of anthrax with a high devastating global impact on public health, animal health, and economy. In 1876, Robert Koch cultured Bioterrorism and first established that the infectious disease from microbial origin which led to famous germ theory. After isolation the anthrax organism from skin lesion of sheep, Robert Koch obtained the pure culture by growing the bacilli on the aqueous human or ox eye and injected the bacteria into healthy sheep. In 1881, the first bacterium used for the preparation of an attenuated vaccine by Louis Pasteur was Bacillus anthracis. Etiology: Bacillus anthracis, a gram-positive, non-motile, encapsulated aerobic, facultative anaerobic, spore-forming rod-shaped bacterium. Sporulation required aerobic condition and it is optimal at 25 to 30 degrees Celsius. Optimum pH for growth is 7.4. B. Anthracis exists in two forms: vegetative cell inside the host and spore for persistent in the soil or environment. Adverse environmental conditions include the sporulation and endospore are released from the mother vegetative cell. The spores are resistant to chemical disinfectant and height. The capsule is compound of gamma-linked poly-D-glutamic acid which give mucoidal appearance to the colony. The spore resist dry heat at 140 degrees Celsius for 1-3 hours and boiling or steam at 100 degrees Celsius for 5 to 10 minutes but autoclaving at 121 degrees Celsius for 50 minutes destroys the spore. In soil, Bacillus anthracis is generally found in endospore from which is dormant, well organized and highly resistant to various stress conditions from where it can persist viable for decades in the form, especially when deposited 15 cm below the upper soil level. Therefore, postmortem of anthrax infected animal is never recommended to avoid the exposure of bacteria to oxygen. A peculiar feature of anthrax infection in animal is that blood does not clot and drain from the natural orifices like nose, mouth, and below. According to an estimate, every year about 2,000 to 20,000 human anthrax cases occur globally. The most recent anthrax cases were found in 2010 in Bangladesh. More than 600 people were died in the outbreak due to consumption of infected cattle meat. Anthrax in India. Anthrax cycle. Pathology of anthrax infection. Major virulence factors are the anthrax toxin and the an antiphagocytic polyglutamic capsule. These are encoded by Two large plasmids, the former by PXO first and the latter by PXO2. Anthrax sepsis. Anthrax sepsis. After the lymphohematogenous spreading of B. anthracis from a primary lesion, sepsis may develop mild initial phase of non-specific symptoms is followed by the sudden development of toxemia and shock with dyspnea, cyanosis, disorientation with coma and death. All these happen within a period of hours. Anthrax meningitis. Anthrax meningitis. Hemorrhagic leptomeningitis is a serious clinical consequence of disease. There is an intense inflammation of the meninges accompanying with edema resulting in a markedly elevated cerebrospinal fluid CSF pressure and the appearance of blood in the CSF. Development of meningitis is a dangerous possibility in all three forms of anthrax. Anthrax vaccine absorbed. It is the only FDA licensed human anthrax vaccine produced from culture filtrate of a toxigenic but avirulent non-encapsulated mutant V770NP1R strain. AVA vaccine contains aluminum hydroxide to absorb protective antigen as well as serve as an adjuvant. Live vaccine. Live attenuated bacilli were first used by Louis Pasteur in May 1881. Russia and China used live attenuated strain for their human vaccine. Live spore from attenuated strain STI first and attenuated strain A first 6R is used in Russia and China respectively. Microscopy, culture, animal incubation, Ascoli test, ELISA PCR, Ascoli test, control approaches, control approaches. Control measures are aimed at breaking the cycle of infection. CDC suggested the following control measure in animal: rapid identification and treatment of affected animals should be done. Enhancement of surveillance system, prophylaxis, vaccination, and quarantine procedure must be followed. Restriction of access to suspected source, feed, or pasture should be implemented. Following of appropriate carcass disposal procedure, disinfection of affected premises and material must be done. The primary action for human include quick identification of animal source of outbreak, person exposed to source, human cases, treatment of uncomplicated cutaneous cases, antibiotic and supportive care for systemically ill patient. Thank you.